Take up House File 2077, Representative Bierman. Representative Bierman moves that House File 2077 be laid over for possible inclusion. I do not see an amendment to this one. Representative Bierman, to your bill.
Thank you, Madam Chair. Thanks for hearing House File 2077. This is in regards to epilepsy and seizure detection treatment. Epilepsy is a condition defined by unprovoked recurring seizures. About 55,000 Minnesotans live with active epilepsy, and 1/3 of those live with uncontrolled epilepsy. Sudden, unexpected death in epilepsy is the leading cause of death in children and young adults with uncontrolled seizures. Those at highest risk of SUDEP are those who have convulsive seizures while unattended at night. Scientific evidence strongly supports that first aid during or shortly after convulsive seizures can be life-saving, and seizure detection devices ensure people with epilepsy are able to receive that attention as soon as possible. These devices are covered under some commercial plans, but not medical assistance fee-for-service. Covering these devices under medical assistance will ensure access to these potentially life-saving devices for people with seizures regardless of income. And Madam Chair, I do have a testifier.
All right, thank you. Welcome to the committee.
Thank you, Chair Liebling, members of the committee. My name is Glen Lloyd, and I'm the CEO of the Epilepsy Foundation of Minnesota. Our mission is to lead the fight to overcome the challenges of living with epilepsy and to accelerate therapies, to stop seizures, find cures, and save lives. I'm here to speak in support of House File 2077, which covers seizure detection devices under medical assistance, advancing health equity in our state. Nationally, 50% of adults with active epilepsy have an annual family income averages of less than $25,000 a year, and about 33% of people with epilepsy are covered under Medicaid. Seizure detection devices can reduce the risk of death and increase quality of life for people living with epilepsy. They alert caregivers when a seizure is occurring, so they're able to provide immediate first aid and mitigate potential complications. Potentially life-threatening complications, including sudden unexpected death in epilepsy, otherwise known as SUDEP, status epilepticus, suffocation, and/or head injury. Sadly, one in 150 young adults ages 18 to 39 with uncontrolled seizures will die, 1 in 150. In addition to income inequities that exist in epilepsy, substantial racial inequities exist in access to care and in outcomes. According to research, African Americans are more likely to experience status epilepticus, and Black individuals had the highest age-adjusted death rate for epilepsy from 2005 to 2014. In addition, Black and multiracial infants and children were 1.5 times more likely to die from SUDEP than white infants and children. Please support House File 2077. Covering these devices under medical assistance will ensure that there are no financial barriers to accessing these potentially life-saving devices for individuals living with epilepsy. Thank you for your time and support of the epilepsy community. I'm happy to answer any questions.
All right, thank you so much. Is there anyone else in the public here who would like to testify on the bill? All right, not seeing anyone. Is there any member discussion? Representative Keel.
Thank you, Madam Chair. I signed onto this bill, and I think it's remarkable to be able to detect seizures and help family as they live with this. But I'm wondering, will there be any challenges with the federal approval? Have you looked into that at all?
Yes, this is only for FDA.
Yeah, go ahead.
Sorry, Chair.
Let's do it. Yeah, go ahead, please.
Chair, Representative, this is only for FDA-approved devices. So there is a device already on the market that is FDA-approved.
Thank you.
All right, Representative Backer.
Yeah, well, Madam Chair, my quick question is how many other states are providing this type of product care?
Representative Bierman or Mr. Lloyd?
Currently, this would be the first in the nation.
That's it, thank you.
All right, thank you. All right, any final word, Representative Bierman?
Thank you, Madam Chair. I think that this is something that will help patients, it will save lives, it will help families and caregivers, And I do appreciate the support of Representative Keel and Representative Nadeau on this bill. Thank you, and ask for your support.
All right, thank you. And with that, Representative Bierman renews his motion, and House File 2077 is laid over for possible inclusion. All right, thank you very much. We will now go to House File 20.